Hi, my name is Dan Spratt. I'm an associate professor in the Department of Radiation Oncology, the Rogel Cancer Center at the University of Michigan. My team and I have developed a new web application that's an integrated model that takes into consideration a patient's chance of dying of their cancer versus the risk of potentially dying from the coronavirus. What inspired this is that right now, across the world, cancer patients are having their treatments delayed or even canceled due to the COVID-19 pandemic. As we know, timely cancer treatment is one of the variables that improves the success and cure rate of cancer treatment. However, this is very heterogeneous based upon the cancer type and the stage of the disease. But what we also know is that cancer patients often are at unique risks to dying of coronavirus, in that older age, having comorbid conditions such as heart disease, high blood pressure, diabetes, receiving things like chemotherapy that can cause immunosuppression. These are just among a few of the variables, including cancer itself, that have been shown to be risk factors from having a severe, if not lethal, outcome from coronavirus. So how does one determine in an objective or quantitative method should a patient come into the hospital potentially for weeks, if not months of treatment during the coronavirus pandemic versus the harms in their treatment being delayed? So nationally or even worldwide, some of these decisions are really based upon resource availability. And so there may not be the option to treat all cancer patients in a timely fashion, even if that is what's best for the individual patient. So we made this model to actually look at and personalize by the individual cancer patient what is the net benefit or harm of delaying their cancer treatment. And this web application is termed OncCOVID. Onc for oncology or cancer, and COVID for the coronavirus. So what this model does is it takes into account first the cancer patient's demographics and the patient characteristics and cancer characteristics. So you put in the patient's age, you put in the patient's cancer type and stage of disease. This then auto-populates based upon population registry data what their predicted 5-year chance of dying of their cancer under normal circumstances and their chance of dying of any cause, so dying of cancer or other causes like heart disease. These can be adjusted by the user if there are other variables that they're aware of that would change this estimated rate. Then it takes into account, does the patient have comorbid conditions? And based upon the published literature about risk factors, things like diabetes and hypertension that I previously mentioned, these can increase the risk of dying of coronavirus. So the user selects how many of these conditions the patient has. You then get into the risk of developing coronavirus. And so based upon the county level estimates, if you're in the United States, or the country level estimates worldwide, using from the Johns Hopkins resource, their COVID tracker, we have linked to their data on their GitHub to have updated information. So the user will select the country, the state, the county they live in, and will get up-to-date estimates about the current wave of the pandemic in their local area. Now, if you live in a different county than where you'd get treated, for example, I live in Michigan, if you lived outside of the Detroit area, but your treatment was in Wayne County or one of the counties that's had a higher incidence of coronavirus, you could personalize your selection based on that as well. You then can select if currently your healthcare system is overwhelmed. So some systems, if they truly are overwhelmed and have limited resources, this can impact your chance of developing or dying of coronavirus. And then there's some estimates like the replication rate, or really it's the R sub T it's termed, that right now it varies specific to where one lives, but this can be adjusted based upon where you live to get the best estimates and where you think you are in the current wave. And this helps personalize where your individual wave is where you live, and then the duration of infectiousness, which the World Health Organization estimates to be around 14 days right now. You then put in your treatment information. So are they going to receive chemotherapy? Are you going to receive surgery? Both of these have been shown in variable ways to be associated with your risk of either developing or acquiring the coronavirus or dying of coronavirus, as well as how many treatments will you be receiving? Is this 40 treatments of radiation? Is this radiation, surgery, and chemotherapy over a 6-month period? How many times will it be coming into the hospital and over what period of time? There is an increased risk of coming into the hospital versus staying at home. And this is one of the factors that's to be considered of developing coronavirus. And then from all the information you've put in thus far, we've estimated using another cancer registry of the impact of treatment delay under usual circumstances. So for example, pre-coronavirus, what is the impact if a patient's delayed a week, a month, 6 months? We've modeled this to try to remove as many of the confounding variables for why patients often can be delayed. And so we've factored in a complex multivariable model these to try to get the independent effect of delaying one's treatment. And all of this gets integrated together with numerous other variables that under multiple tabs in the model, you can change all these default estimates based upon if you've got new information or information that's more specific to exactly where you live. And what ultimately it generates is, under 3 different tabs, is the following. So number 1, it gives you the estimate of a patient developing coronavirus under immediate treatment conditions or a delayed treatment conditions, and how much you delay treatment is also user specified. The next is what's the chance that this patient may die from coronavirus under immediate versus the delayed treatment circumstances, and what's the chance that they would die of their cancer from the treatment delay. And this gets integrated together into an overall survival estimate of the 5-year estimate of their overall survival, factoring in both the potential of dying of coronavirus versus the chance of dying of their cancer from treatment delay. And the next tab visually displays this. These are Kaplan-Meier curves of the immediate versus delayed treatment conditions, and it generates what's called the restricted mean survival time estimate. And given that these curves often do not meet proportional hazards in that they often cross, whereas early on there may be a higher risk of dying of coronavirus, but later on the effect of delaying cancer treatment trumps the potential risk from coronavirus, it's more proper or correct to use this restricted mean survival time. And so you can see under both conditions this estimate listed either in years or in days for the user, because it may be very small. And you can zoom in on the Kaplan-Meier and on the right-hand side see up close in case these are very small differences. And the last tab is the SIR model. And really this is showing you sort of the curve that people are always talking about kind of in your area based upon the inputs that you've put in. So based upon all the different inputs, what we've shown by using this model is that going back to that 3-tier model that many people use to justify who gets treatment now versus later, what we show is that is very inaccurate and highly subjective, and that there are patients that are in tier 1 that right now we are giving them treatment around the world, but actually they should probably be deferring treatment, and that they may be elderly with numerous comorbidities, and actually the risk of dying from coronavirus is much higher than the risk of dying from cancer from delaying their treatment until the peak of the pandemic has passed in their local area. And in contrast, there are patients who are in tier 3 that actually have essentially almost no risk of dying of coronavirus, but some risk of dying from cancer from delaying their treatment. This could be a young, healthy individual with an exceptionally low risk of dying of coronavirus. So this provides the first quantitative tool to our knowledge to actually estimate, should you be delaying treatment for these patients? And if you have to delay treatment due to resource availability at your institution, what is that predicted impact for your patients so you can share that with them and better understand the impact to them? Finally, what this tool has been able to do is, in many circumstances, but not all, we're likely going to see a net impact over the next 5 to 10 years and beyond from delaying many cancer patients' treatment, that although in the short term there is a significant benefit of these patients delaying their treatment so that they do not get exposed or die from coronavirus, what will happen is that many of them, unfortunately, from delaying their treatment over the next decade, will have increased risk of cancer death. And we probably won't see this for many years to come, but this is going to be a consequence that is going to be something that we're all going to need to deal with, both on the financial as well as on a personal level with our patients, for them to better understand. So there's going to be a societal impact of this for many years to come. And so we hope that this tool, although it is not in any way meant to make individual treatment decisions, this is a model with lots of assumptions, it does provide something to help you to better understand the risk-benefit ratio of how you're practicing today in either continuing to treat patients or delaying their treatment. And as new data comes out, some of the estimates that are used will be refined, and we'll continue to update this application. And we look forward to collaborating with other people as they have other ideas of how best to utilize this. Thank you so much.